discussion naman, but we just needed that our experts also provide us with whatever they have as evidence and give recommendations to the department.
The Food and Drug Administration has issued an emergency use permit for the bivalent COVID-19 vaccines of Moderna and Pfizer. These bivalent vaccines target specific variants of COVID-19, including the highly transmissible Omicron variant.
The Food and Drug Administration of the FDA gives the green light to bivalent vaccines from Moderna and Pfizer, while the Health Department is yet to finalize data procurement and guidelines for administration. What does the population need to know about these new vaccines? Can bivalent jabs really provide better protection, especially against the newer variants? We discuss in this episode of The Chiefs. Welcome to this Wednesday edition of The Chiefs. I'm Ed Lingao. Let's talk about our lead story with Vaccine Expert Panel Chairperson, Dr. Nina Gloriani. Ma'am, thank you for joining us and welcome back to The Chiefs.
Yes. Good evening, Ed.
Good evening, ma'am.
And to all of you.
Yes, finally, good news to a lot of people. FDA releases the EUA, or the Emergency Use Authorization for the bivalent vaccines. But ma'am, let's back up a bit. Exactly what are these bivalent vaccines and how different are they from the ones that we had in the last 2 years?
Okay, the original version is made up of Wuhan strain, the original strain, the prototype strain that we call. So itong bivalent, monovalent yung una. So the bivalent, as the name implies, it has two components. So the first one is the Wuhan strain, half of it, and then either B1, Omicron B.1, or Omicron B.45. Yon. So the advantage is that the circulating variant now is Omicron.
So this should address at least up to the latest subvariant that has come out. Pero ma'am, we've also been learning in the last 2 years na the virus has been mutating at the rate of what? 2 mutations per, a mutation every 2 weeks. At least the last time I heard. So what's the chances? What are the chances of this virus mutating further?
So far, what we have seen is yung Omicron, all of these mutations, subvariants are Omicron pa naman.
Okay.
So BA5 especially, so sino ba nagsanga-sanga na yan? May offspring si BA5. Meron siyang BA45, BF7, the one currently driving the surge in China. Then you have BQ1 and 1.1. Lahat yan galing from BA5. So if you consider the bivalent vaccine containing BA5, we should expect that it will cover those.
Ma'am, I guess it's also important to point out na the original virus is quite different from the latest subvariants. Although they're both COVID-19, pero medyo malaki-laki ang pagkakaiba.
Yes, wala na si Wuhan. Parang nawala na yung mga dati, no? The original, Alpha, Beta, Delta, then we have Omicron basically circulating or predominant all over the world na. So, but these viruses, they have some things common then to the ancestral strain. So they have something common. So, but they have mutated so much, so yun nga, to increase transmissibility and to evade immunity from infection or from vaccine-induced immunity.
Ma'am, ako personally, I've been waiting for this bivalent vaccine for what, almost a year? Kasi the last time I had my booster, I've had only one booster shot. I think a lot of people have only had one booster shot. Kasi we're not yet entitled to the second booster shot, not unless nga you have comorbidities or you're a senior citizen. So a lot of people are actually waiting for that second booster shot that hasn't arrived yet. What are we looking at for this bivalent vaccines? Is there going to be a priority list as well? And will it be the same kind of priority list as before?
Yeah, definitely there will be prioritization again. So we start with the healthcare workers, so A1, A2, and A3. So basically, the ones who are most vulnerable to getting COVID, especially in the light of these subvariants circulating. So the DOH should be able to come up with guidelines soon, so that by the time the supplies come in, which we hope by early next year, then we know who to give these vaccines to. So not everybody.
Well, not everybody yet, or is that not everybody at all? I mean, I asked.
Yet siguro. We cannot say at all. Usually, we have to wait. There could be some data that will be coming in so we can reassess, reevaluate what's happening. And then depending on the supplies, for all you know, the Omicron may be, ano ba yan? Overtaken again, no, by something else. We hope not. But anyway, so far, the Omicron is circulating.
Yes,
so we should be...
Well, I ask whether it's not yet or at all. Kasi ano I mean, at one time or another, I suppose dating yung panahon, well, government will say na you should be able to buy your own vaccines already. Hindi na EUA, di ba? There will come, we will hit that point in time sometime or another. Eh. And I'm wondering if that's anytime soon.
Well, we are hoping these vaccine companies will apply for the Certificate of Product Registration, what we call the CPR. Then if they apply for that and they are approved, then that will make these vaccines available to the private sector. Then we can just buy which ones we prefer.
At which point, you don't have to wait anymore in line dun sa priority list. Is that correct po?
No more, yes.
Pero ma'am, what stops the companies from doing that, from applying for the certificate of product registration? I suppose it's a much more complicated process of vetting the virus, the vaccines. Is that it?
One of the basic, what's the most important considerations there is under EUA, it's the government that takes care of any possible adverse effects.
Oh yes, the indemnity.
Kapag ka-CPR na yan, it's the company that will take care of it. So siguro, I don't know. I'm just making a conjecture at this time, no? If you buy under EUA, bulk pati yan because it's the government buying it.
Opo.
Pero pag ka-CPR na, competitive na yan. Market forces.
Opo. So there's not that much encouragement for the companies to apply for that yet.
Kasi, that's true, but we have to get there. We have to get there. We need CPR for these products.
But are we seeing any movement in that direction already? By not by our government, but by any government? Is any government in the world looking at moving towards
we have
commercial?
CPR in the US for the mRNA vaccines. They're already CPR. They're not under EUA.
Okay, but does the US government still buy vaccines and give it out for free, or hindi na rin po?
I think it's still free at this time. I think it's still free.
But how do they handle that?
Anywhere, masarap nga doon. Go to the...
Oo nga po to any pharmacy. But how does their government handle that? On one hand, they're giving it out for free, but on the other hand, the companies are free to sell the vaccines. I mean, hindi ba? Parang may competition ka na libre. I mean, I'm wondering lang how that works.
I'm not sure how they, but I did see some figures. May cost yung bago, itong bivalent. Hindi yung dati. No, that they can, I don't know if that cost was for the private sector or for the government. Kasi dati, nasa $50 per dose siya, naging 100. Ngayon, I saw something like 200. Maybe that is for the updated version already.
Okay. Well, for people like me who are still waiting for the chance to get a second booster shot or a bivalent vaccine, given the fact that, well, number one, kailangan pang mag-priority list yan, gagawa pa ng guidelines ng DOH and all that, and then the implementation of the priority list. So, for all we know, kaming mga medyo hindi delikado will be lined up later pa in the year. What are the chances of us getting, for example, yung...
I think the second booster should be available to everyone na. I think
yes,
the DOH is considering that already. Baka wala pa lang yung talagang final guidelines.
Yes, ma'am. Actually, that's what I wanted to ask. Kasi we've been asking about the second booster shot for the original booster, but the DOH has not given authorization to use that, and we've seen the wastage of a lot of booster shots over the past few months. So, yun po eh, there's that conundrum eh, na nasasayang ilang booster shots, hindi ilan eh, maraming booster shots. And on the other hand, you have a lot of people who are still waiting for the chance to get a second booster.
And we do need the booster to increase our ramp-up, our protection.
Yes, ma'am. Yes,
So
ma'am.
I think that the DOH is going that way naman na.
Okay. Is that... Ma'am, I'm sorry, ma'am. Kaming layman kasi, we can't figure out kung bakit may hesitation ang DOH doon sa point na yun eh, yung giving out that second booster shot. We've asked that several times from DOH officials, including Yusek Vergere, and they've said repeatedly na they have not seen any evidence that shows that it gives any significant protection as a second booster shot. I mean, it doesn't give you that significant protection. No evidence yet, but from people like us, we're thinking, as long as it doesn't harm you, what's an additional protection? Kesa masayang. So
Yeah, that's correct.
yun po yung
And
namin.
we're talking about waning immunity, ha?
Yes, ma'am. Yes, ma'am. Kasi ma'am, for example, January pa yung huli ko. I'm sure a lot of people here have the same problem.
That's true. That's true. So too long ago.
Yeah, it's 1 year, ma'am. In 1 week, it's 1 year already.
But to the US, you can get the booster.
But and yet we're seeing we're seeing billions of pesos worth of vaccines going to waste. So yun po, I can imagine a lot of Filipinos who are conflicted with that, and they can't understand that. And ako personally, I can't understand it myself. I'm wondering kung anong discussion sa medical community about it. Is there any debate about that? Is there any discussion on that?
Well,
moving forward?
discussion, maybe not really the debate, because we have to listen to the DOH, the HTAC. Because remember, we are procuring the vaccines. Of course, you said we have too many, and they actually got wasted. Yung cost effectiveness of all of this. But it's really HTAC because this is all under EUA. So it's the HTAC that makes the decision.
Yes, ma'am. Okay. Sige, I'll move on na from there. Baka nagiging masyadong sa akin nagiging masyadong personal sa akin But kasi like I told you, there are a lot of people who are also waiting for that second shot and they're waiting eagerly for that. But anyway, moving on to the bivalent vaccines, ma'am. DOH is going to release guidelines for the release of the bivalent vaccines. From your end po, what would you suggest as guideposts or guidelines for the administration of these bivalent vaccines? Would they be any different from the previous vaccines?
I don't think it will be different. No? The prioritization remains the same. A1, A2, A3. Then saka mahuhuli yung iba. But remember, because of the wastage, we are more careful now in procurement. We do not want to get too much of these supplies, no? And pay for them. So actually, they did a survey yata. I don't know if it was DOH or the public group yung undergo negosyo. Pero they're only looking at people who are really interested in getting it, and then that's how they will manage the procurement, the number of doses.
Okay. So hindi siya isang bagsakan ng maramihan. They might be looking first at the demand side.
Yes, kasi nga, but I think yung private sector has a high demand. Pero we have to consider din the public sector who cannot afford, like the
Yes,
A2,
ma'am.
A3. No? Oo.
Yes, ma'am. Is the private sector also going to get their own batch like before? Is that also in the works, in the discussion?
What I know is with Go Negosyo, itong kay Sir Joey Concepcion, they're really looking at getting the vaccines for the private sector. So how to do that is medyo complicated because it is under EUA. But it will probably have some headway soon.
Mm-hmm. Of course, ma'am. Yes, ma'am. Of course, the other challenge, of course, is this. I think as of now, our vaccination rates are still pretty low compared to a lot of countries in the region. The New York Times, citing government sources, said that only 68% of the population has been fully vaccinated. I think that's the general population. I don't think that's the target population. 68% daw.
Maybe that's the general.
Opo.
Kasi ang target population natin is only 77 million.
Yes,
So
ma'am.
we have 94-95%
Yes, ma'am.
coverage already kung
Yes, ma'am.
target.
Opo.
But our booster is very low pa.
Yeah, that's the one. That's very low. And
Sa A1, 56%.
the boostering, ma'am, boostering.
Oo, sa A2, 40%. Sa A3, 31%. A4, higher a little, 35%. This is as of December 21. I got that kasi sabi ko, we really need to ramp up the first booster at least, no? But we should
yes,
not
ma'am.
wait for those who need the first booster. Kung yung mga nag-first booster, it has been a long time since they got the first booster, ready for second booster. I think we should give them the second booster. So.
Pero yun nga, ma'am, the challenge is that if you have only 35% of A4 getting their booster and the other 65% not bothering, I suppose government is facing the possibility of buying vaccines that will not get used again. Diba? So that yun yung pagtitimbang eh.
Yes, that's why they are doing the survey, and if it is the private sector that will pay for it or procure it, it may be more manageable.
And of course, the other thing is this: we've sort of normalized life in the last few months. We're back to face-to-face. Everybody's back to work. Well, almost everybody's back to work. Kokonti na lang yung nag-work from home. And mask usage has really gone down significantly. At least what we can see in public. Any concerns na especially given our low boostering and the possibility of low bivalent boostering shots? Any concerns about this?
We are concerned, of course. And we need to explain to people that they should still continue with their public health precautions, especially masking. It is very unfortunate that it became optional. Sumusunod naman tayo eh. So, pero in fact, I think marami pa rin. There's a lot of people who still wear masks, especially in crowded areas. Siguro may konti na lang na din na mga medyo they're reluctant or hesitant, I don't know, for one reason or another. But generally, I still see people wearing masks.
Yes, ma'am. Pero not like before. I mean, it's really completely radically different.
Tama ka. Kasi pagka required, di ba?
Opo. Iba-iba yung ano eh.
Sunod naman si Pinoy eh. Sana ni-record na lang. Yes.
Pag sabihan mo kasi yung Pilipino na, pwedeng oo, pwedeng hindi. Yun naman pala eh. And then you go back to the same problem as before. But are we seeing any numbers that are concerning, ma'am? O hindi rin?
Numbers in terms of COVID cases?
Well, not just COVID cases pero more specifically, ma'am, yung hospitalizations for COVID eh.
Well, I'm not really sure kung official yung mga yon, no? Kasi a lot of the COVID wards have become full. Yun ang sabi nila, no? Pero we need to get yung talagang official from the UH. At least from the private hospitals that I know, medyo dumadami talaga yung yung COVID ward admissions nila. So we have to be careful. Why this is happening now? Because of the mobility.
Yes, ma'am.
The parking and all of that. We, as DOH was saying, or Dr. Guido was saying, by middle of January, it will run to 4,000. I hope not. I hope not. Kasi medyo bumababa naman sa NCR, pero sa ibang provinces, tumataas naman. Because this is where the people are going, di ba? Nandun sila ngayon, nagbabakasyon.
It's revenge spending and revenge traveling.
Yes.
So that's what you have. Pero, ma'am, the numbers you cited, I think they're numbers nung new COVID cases if I got that right. Those are new. But also, ma'am, we're also looking at the fact na na bumagsak yung COVID testing natin. I mean, not as many people are testing anymore as before. So for all we know, yes, ma'am. So for all we know, the 4,000 is actually a huge underestimation of the real numbers we have.
The antigen testing has gone up, but that is not reported.
It's not reported.
Yes, and people do not report and do not, I don't know, of course, only those who go to the hospitals get the RT-PCR. So, I don't know, maybe that number is really under-reported.
I was going to ask you if we have any numbers on utilization rate in hospitals, but I suppose it's the DOH that we should be asking. I don't know if you have it.
I think yung pa rin, hindi pa naman ganun hindi pa siya tumataas
Okay.
na
So, hindi pa
nasa
significant.
mga 25 pa rin.
Yes, ma'am. Although, ma'am, kakapasko pa lang, so baka hindi pa lumalabas yung mga...
Yes, that's true. Hindi pa tapos ang holiday
may New Year pa.
season. Yung mga inuman, mga kainan, hindi pa tapos.
So, yun nga, baka...
But there are a lot of cases na mild and asymptomatic, ha?
Yes, ma'am.
Yung mga mild, marami yun. Na driven by the variant. Marami
Yes,
yun.
Ay, ma'am, let me ask you about...
Nakaka-actual.
Yes, ma'am. Ma'am, the new variants, we keep reading about the new variants being more infectious, but parang we don't hear anything conclusive about their severity.
No, we don't have data yet on the severity. So far, Omicron silang lahat.
Yes, ma'am.
What we watch out for is another variant that is not Omicron. Sana walang ganon.
Okay.
So far, si Omicron, yung mga anak ni Omicron, anak-anak, apo, ay are still mild. Hindi sila, except of course in the elderly and those with comorbidities.
Yes, ma'am.
Pero they're relatively mild.
So generally, so long as Omicron stays dominant, we're medyo in the okay field. Wag lang may lumitaw na
Wag lang lumitaw yung iba.
yung iba,
But
like yung Delta.
that is possible kapag the virus continues to be transmitted massively, as for instance, what is happening in China now. Kasi yun yung magdadrive ng mutation. So we don't know how the mutation will go, in which direction. So we hope Omicron pa rin, but we do not know that.
Yeah, so the key to this is keeping the infections down so that there's so we don't have a huge laboratory for more mutations.
Yes, that is what we have been saying all along. Keep the transmission down, the mutation down. But we cannot do it. I mean,
Okay. Ma'am, sige, let me leave to you the final words for this segment. What advice would you want to give to Filipinos for this coming year, 2023? Coming into the third year of the pandemic, what should Filipinos remember or keep in mind coming to the third year of the pandemic?
what can I say? We're now living with the virus. So, but what I would like to say is that the pandemic is not yet over because of the surges with the variants and subvariants. So we have to continue to watch our mga masking, public health precautions, and of course get the vaccines. And we hope the DOH will be able to approve yung second booster na, and then of course good news, the bivalent, but of course to vulnerable population. And then the children also will get their boosters soon. So meron naman na tayong ganon na guidelines, approvals from the FDA. And then coming forth pa yung younger.
Okay. So second booster na, ilabas na ninyo.
Sana. No, I want the economic sector actually to get that.
Yes, ma'am. Yes,
Kasi
ma'am.
expose sila.
Tsaka kesa naman masayang eh. In the end, that's what people are asking eh. Kesa nasasayang, kung di naman nakakaperwisyo, paggamit na.
Yes. And the original vaccines are still good.
Yes,
still
ma'am.
good. Pag nabigay
Yes,
mo as
ma'am.
boosters, pag nakatatlo, apat ka, they're still good.
Okay, maraming salamat po, Dr. Nina Gloriani, Chairperson of the
Thank
Vaccine
you.
Expert Panel. Ma'am, maraming salamat for
Thank you
joining us tonight.
very much.
Ingat po parate.
Ingat, take care. Happy New Year.
Happy New Year po. We are starting up another conversation after this breather, so keep it here in One News.
The National Telecommunications Commission has ordered telcos to submit reports on the issues concerning the first day of SIM registration. Meanwhile, digital advocates are flagging the verification process that requires users to take selfies. The DICT defends the use of selfies in SIM registration after concerns were raised over its possible violations to privacy.
Yung selfie verification, importante po yun. It's an additional protection to the Filipino consumers. Kasi marami po ngayon na tinatawag na spoofing. Ibig sabihin, they will claim your identity kahit na hindi po kayo yun.
And welcome back to the Chiefs on One News. Kasama ko po ngayon ulit ang co-anchor ko po sa Wag Po sa 1PH, si Mr. Ronald Llamas.
Good evening, Ed.
Good evening.
Good evening, everyone. Good evening, Attorney.
Hindi pa tayo narinig ka, Attorney. Tika, pakilala mo na si Attorney. Okay. Okay. And tonight we continue the conversation on the SIM card registration or the SIM registration process with Dito's Chief Admin Officer, Attorney Adel Tamano. Sir, magandang gabi and welcome to the Chiefs.
Thank you very much for having us here. Thank you. Good evening.
Good evening. Buhati.
Good evening, Adel. Long time no see.
Long time no see. I think now the first time you've seen me with my gray hair.
Oo nga.
Okay lang yan, sir. Si Ronald naman, hindi lang gray hair ang problema niya.
Wala ka naman balak tumakbo, Adel? Binoto kitang senador dati.
No more, sir. Very happy working for
Yeah.
Well, sir, let me start off with this. Kamusta po registration yung kahapon sa Dito? We've heard from Smart, we've also heard from Globe. What about Dito?
I'd like to start off with some numbers, if that's okay.
Go ahead, sir.
So as of 2 p.m. today, we have 598,062 total successful registrations. No, that's of that, about 12,000 are new subscribers. Now, kailangan natin tingnan to in its context. No, we're a lot smaller than Smart and Globe. We only have about 15 million subscribers. But almost 600,000 is actually a very big percentage na. And I'm very happy to report that we haven't had any really big problems, unlike the two other telcos. Our system did not go down. In fact, I can also report that there was an attempted hacking attempt on our server. It lasted for 22 minutes. Yesterday, but because of the protections that we had set up our intrusion prevention system and our firewall, it really didn't affect our system. The only thing it did was for about 5 minutes nagka-latency kami ng konti. So all in all, we actually have been quite, modesty aside, quite successful. I think in a way nag-over-prepare po kami, and we really wanted to make the process for our subscribers very easy and rewarding too at the same time.
Attorney, itong hacking na ito, meron ba kayong suspect at anong possibly yung dahilan? Bakit kayo hinahack? No?
So ini-investigate namin yan, Mr. Llamas. The basic, this is our theory. No? There are a number of criminal elements that do not want SIM registration. No?
To succeed.
The attack actually, that was the malware that was sent to our system, was to create a denial of service, meaning that the portal would be closed. No, I think the criminal elements, they do like the cloak of anonymity that not registering the SIMs will cause, and I don't know if Smart and Globe will confirm, but I think kaya nag-down yung mga systems nila kasi inattack din sila. I think medyo swerte kami. We actually use military-grade cyber protection systems. In fact, in terms of personnel, our Chief Technology Officer is retired Major General Rodolfo Santiago. I don't know if Mr. Llamas would remember him.
Yeah.
He's one of the really experts sa communications technology sa bansa natin. So we actually were quite ready for those attacks, and we expected it. We knew there would be bad people who would try to down our system.
Sir, you're saying, Bale, na na the hacking attempt was not an attempt to steal your data, but it was an attempt to just simply to put down or take down your
Yes,
server so
yes.
that nobody else can go in.
Yes, ang tawag ng denial of service. I don't know what the next step would have been, no. But I think more than an attempt to get the data, kasi early days pa lang yun, which means you don't really have that much subscriber data yet, di ba? So it was really more so that similar to what happened to the two telcos, nag-down yung system nila. And again, because of the integrity, no, and the strength of our cybersecurity system, we were protected. And in fact, the only effect was for about 5 minutes, our latency in our app, which is our portal as well, went down a little bit. But other than that, there was really no effect.
Attorney, sabi ni USEC ng DICT yesterday, last night, approximately 1 million yung na-register nila kahapon. Ang sinasabi nyo, almost 600,000 yung sa dito. Ibig sabihin, 400,000 lang yung two other telcos ang na-register?
No, yesterday, sir, we ended with around 250 plus, halos 300,000. So I think even kasi nag-down din yung system, di ba, ng Smart and Globe. So there was Smart said 20 minutes na sila. Globe, I think baka mas matagal. Kami continuous, wala kaming down. So I think that's why kahit na maliit kami, it's possible na mas marami yung na-register namin comparatively, no, yung first day. But the number I gave you today, sirs, yung halos 600,000, 598,000, that's 2 days na po yan.
Sir, is it possible to track down or to trace this person who tried to get into your systems? Kasi ako, I really find it curious na talagang day one may sumusubok na, may nagbabalak na.
No, we are doing that. The head of our cybersecurity, also a retired military man, Colonel Rolin El Prado, no? He's actually, we're conducting our investigation. Although for those quite familiar with cybersecurity, minsan no, maraming IP addresses ang ginagamit nila. Hindi yun madali, hanapin lang eh.
Yeah.
But we're conducting an investigation and we've already sent our reports, no, to the NTC and to the National Privacy Commission as well. Although hindi nagka-breach, although it was unsuccessful, we still believe it's necessary to inform, no, our regulators that there are these criminal elements who will want to mess up, no, and stop SIM registration.
Attorney, interesado ako, paano kayo nagko-coordinate dun sa rivals nyo na mga telcos dito sa proyektong ito? Dahil alam naman natin, no, in the dog-eat-dog world ng IT ay very competitive at very ruthless. No? So, paano kayo, sabi nga ni Presidente Bongbong Marcos, paano kayo nagkaroon ng unity
Sabi niya, papasok yan.
dito sa proyektong ito, sa SIM card?
Well, I have to speak very highly and positively of our partners in Smart and Globe. No, when we had our technical working group meetings, which oftentimes would stretch as late as 11 p.m. No, there was definitely mutual support. In fact, even before the meetings with NTC, nag-uusap naman kami. I mean, in the market, we're obviously competitors. Sige, bakbakan tayo dyan. But when we're not in the market, we see the importance of this initiative and we all want it to succeed. I don't think there's any telco that does not believe, despite, and I'll be very candid with both of you gentlemen, no, napaka-expensive ng ginagawa namin mga telcos to make this initiative happen. And the law actually does not allow us to add on any cost to the consumer. So we eat all of the costs, no? But because we truly believe that this is very important for the safety, security of our consumers, that's why we're not only working hard, but we're investing billions of pesos, no, to make this a success. Sana maging success. I know there are some people who are saying negative things about it. Masyado raw minadali, bakit nilagyan ng verification? ang point of view nandito dyan is actually, we're a full compliance company. If the government wants us to verify, we'll verify. Kasi we strongly believe in the importance of this initiative. For anyone who has experienced yung mga kidnap for ransom, cyberbullying, etc., this is a good step to fight against it.
I don't want to belabor the issue, Attorney, no? Pero siyempre, isa sa highly guarded secrets nyo is your own technology, IT technology. At to some extent, with this unity on the SIM card registration, you have to share some of your technology. So, how do you do that, no? Na pagkatapos nitong proyekto na ito, magbabakbakan na naman kayo ulit. No?
Well, actually, sir, hindi po kami nag-share ng technology. To be very candid. And in fact, in terms of resources, langgam kami. We're an ant compared to these two giants, no. We don't have the resources, to be very honest. So the technology that we use is different. I think, if I may just I hope this comes out in a positive way. I think the reason why we have far less problems with our registration is we actually don't have legacy systems like 2G and 3G. 4G and 5G lang kami. And our registration is actually app-based. We have a Dito app which 90% of our 15 million subscribers use, no? So because our technology is so advanced, I think it's harder to hack. It makes the registration simpler. And in fact, we've approached this registration in such a way na not only are we encouraging our subscribers to use our system, which is really so simple. A dinosaur like me, I will be very honest, I'm not a techie, but it took me 3 minutes and 24 seconds to register, no? If I can do it, anyone can do it. A large part of that is because of the technology that we have. And we will be very selfish. We're not going to share this because it's proprietary. But of course, we encourage the other telcos to step up their game and similarly, perhaps migrate to 4G and 5G and maybe be app-based as well.
Sir, there were some complaints about selfie verification. Personally, I don't know how it works or how necessary it was. Pero there were some people who were saying na hindi talaga siya dapat kailangan. What do you think? And does Dito use that?
Yes, so my selfie verification din kami. When the IRRs came out, there is a provision in the IRR that says we enjoin the PTEs, telcos, na to verify the identity of the subscriber. Kasi, so you have 17 possible IDs or documents that can be used to provide information. But the challenge is it really the same person using it? So the simplest way to do it is which is the Dito way, no? We only have 4 pages na kailangan mo i-fill up. Yung first page, yan lahat ng information. Second page actually is you take a picture of the ID, for example, driver's license. Yung last, it's the verification. You take a selfie with your ID or passport or whatever, and that is our basis to be able to ensure, no, na ikaw nga yan talaga. Kasi yung SIM registration naman, hindi naman to mechanical na approach or process lang eh. This is actually, there's thinking behind it where we want to be able to identify who this person is. So this is the first step, actually. In fact, sirs, since this is going to be ongoing, diba, forever na itong SIM registration eh. Anyone who buys a new SIM will need to register. In the future, ang plano namin sa Dito, and this again will cost billions of pesos, but we do intend to invest in it. We will actually, as in other countries, use AI, artificial intelligence. The facial recognition na lang. Pag mo sa ID, parang may masascan na yan ng computer or ng system mo, and it can verify who you are, no? That is our future state. And another thing that I would like to add, siguro pinag-aralan din po namin kasi yung how this is done in other countries eh. I think once the government has a national ID database na talagang lahat halos lahat ng Pilipino may ganon, verification will be so much easier. But for now, since we don't have that, we have to go through this, I think, a little bit cumbersome method na magse-selfie ka pa. But ang message namin sa ating mga subscribers is, pasensya lang ng konti, but let's support this SIM registration because although medyo hassle nga, magse-selfie ka pa, you have to give info, at the end of the day, we're doing something very important. And if I can add lang, sorry, just to encourage our Dito subscribers, on the Dito side kasi, if you register, we give you a bonus of 2 gigabytes. Yan ang pang-inganyo namin because we believe one of the bigger challenges actually is how to convince people to register.
Attorney, kumpara kasi doon sa the two other much bigger telcos, no? Ay ang Dito partner in China Mobile. Ano yung role nila dito sa important na SIM registration project na ito? Hindi ba siya nag-create ng problema dahil highly mataas yung level ng national security aspect dito sa SIM card registration?
Sure. First, it's China Telecom. China Mobile
yeah.
is another company.
Yeah.
I'll just say 2 things about it. The first one is, unlike Smart and Globe, before we got our franchise, we actually had to submit a cybersecurity plan sa DICT. That's one. And then second, we knew that people would have issues about China being our technology partner. So when we got our security systems, we actually got an American security provider because we wanted to, even internally, and we actually had a lot of back and forth internally, but we finally decided, let's get an American security provider so that any concerns about this, the data being used or may mga security or national security issues, that would be addressed by the fact that we're actually using a security provider that is not connected with China. And sorry, one last point lang is, Dito is a Filipino company and we want to assure the public na definitely yung any information that we have, especially private information, we will conform to the Data Privacy Act and all of these are absolutely confidential.
Sir, yung online registration actually may be the easy part pa eh. Kasi, it's online. It's just that just getting the right amount of bandwidth and the right number of servers and all that. Some might say the more complicated part is getting those who don't have internet connectivity registered. Yung mga nasa probinsya, nasa mga malalayong lugar, yung mga ganun, where you would have, I suppose, to put up facilities for registration, physical registration. What are your plans for that?
Dagdag dun sa tanong ni Ed, Attorney, paano nagulat kami kagabi dun sa Undersecretary ng DICT nung sinabi niya na 65% ng mga communities sa atin ay hindi connected online, no? Paano maayos yan in a few months? No, yun yung tanong namin sa kanya kahapon. Kung ganyan kalaki yung hindi covered ng mga bandwidth, ng mga internet, no? How can they register? No? April yung deadline, it can be extended. Pero
yes.
How do you fix that?
Yeah. So Ronnie, yung approach namin is first, we can't do this alone. And that's why when we had a press con 2 days ago, maganda po yung DILG, USEC, si Attorney Gutierrez, no? From the DILG. But it was very clear that we need to partner with them for that specific situation. That's number one. And then number two, for those areas kasi, I think dito is a little bit unique kasi we actually are mandated to serve the more underserved areas. We are putting a lot of money actually in areas, for example, like BARM. I think these are the areas, the critical areas na usually wala masyadong internet access, no? So as a company, we are already addressing that. We have a government commitment actually to have a population coverage of 84%. So hopefully that addresses that. But in the meantime, with itong SIM registration, very clear sa amin na we can't do it alone. No? We will really need the DILG to support us. And in fact, even the IRRs naman acknowledge this. And when you talk about registration in the remote areas, the local governments are actually enjoined to support us, especially for dito, because unlike, again, Smart and Globe, who has really so many resources, they set up booths and all that in those far-flung areas. Kami, we really will also need the help and partnership with our LGUs and the different groups on the ground who can help us to help register those people in the areas where internet connectivity is not so good.
Mm-hmm. Pero sir, at least in broad strokes, are you looking at putting up, for example, booths in the municipal level or possibly even the barangay level or the CTO level, or maybe that's too much na?
Physical registration.
Oh, paano ho yun? What are we looking at?
Sorry, yung approach kasi namin is a little different. First, we want to clarify that we don't have 2G and 3G legacy systems.
Yes, sir.
It's really those people who have those types of subscribers who have those types of phones that you will need that physical registration. We have really set up our system na napaka-simple lang using the Dito app that you don't have to go to those physical areas. Now, maybe there are a few people who will really need support to do that. So the way we've approached it is that throughout the country, we have 24 what we call Dito experience stores. So our subscribers just have to go there. We've trained our employees. People who really need help, sila nang tutulong sa kanila. But to do it on a parang magse-set up ka ng laptop and be the one to do it, I do have concerns if you do it that way because of the security concerns, because you're using another person's computer to input your data. Sa amin kasi, you just use our portal So walang third party na pumapasok. It's far more secure and it's also much safer. So we would prefer to keep it that way na just using the Dito app in order to provide the SIM registration information and to register.
Sir, tell me if I'm getting this right. What you're saying basically is that your subscribers more or less use 4G and 5G and smartphones. More or less, parang ganun po.
Yes.
Very few of your subscribers, if at all, still use analog and are not connected on the internet. Is that correct?
Yeah, it's correct. Actually, we don't have any 2G and 3G phones kasi yung frequencies namin, the frequencies that we were given by the NTC is only 4G and 5G. So the approach was, we could have decided, sige, let's lease 2G or 3G frequencies. But the approach was, no, we believe the Filipinos should get the best type, technology. And so we took a gamble and we just actually stuck with 4G and 5G phones, that were compatible to us. And we see that the gamble seemed to be paying off, especially sa SIM registration, because of the ease that enables people to register because of the 4G and 5G connectivity. Mas mabilis talaga Mas mabilis at mas secure ang 4G and 5G compared to the legacy systems that Smart and Globe still have.
Okay, maraming salamat. Attorney Adel Tamano, Dito's Chief Administrative Officer. Sir, thank you for joining us
Happy
tonight.
New Year, Adel.
Happy New Year and thank you very much. Thank you for the time. Thank you.
Ingat po. And of course, thank you again to my Wag Po co-anchor, Mr. Ronald Llamas, who's again with us tonight.
You got my name correct.
Hindi ka na na Raul, And that's it for the Chiefs. We hope what to discuss here will keep the conversation going. I'm Ed Lingao. We are One News, all sides and all the time.